Bismillah ar-Rahman ar-Rahim. Hello everybody, I'm Redha Al LAwati, 50-year medical student, and I'm going to talk about chronic pain. First of all, we have this case. KA, 35 years old male, presented to primary care clinic complaining of dizziness, backache, nausea for 3 days duration. When we reviewed his file, it showed that in the last 7 months, he presented with the following: abdominal pain, nausea, intolerance to 15 different foods, backache, shortness of breath at rest, chest pain, dizziness, difficulty in swallowing, palpitation. While doing the investigations, while reviewing the investigations, we saw that he did ECG for 6 times, blood test for 5 times, chest X-ray 3 times, ultrasound for abdomen 2 times, CT scan for abdomen 2 times, upper GI endoscopy 2 times, and colonoscopy 1 time. Surprisingly, all investigations were normal. So, this thing called somatization. So now we want to know what is somatization. Somatization is defined as tendency to experience psychological distress in the form of somatic symptoms and to seek medical help for these symptoms. And these symptoms may be initiated or aggravated by emotional responses such as anxiety and depression. Patients with somatization account for about 20% of the workload in general practice. In the Diagnostic and Statistical Manual of Mental Disorder, the 4th version, somatization was defined as a polysymptomatic disorder that begins before the age of 30, extends over a period of years, and is characterized by a combination of pain, gastrointestinal tract symptoms, sexual and pseudoneurological symptoms. But now there is a new definition or a new name. It is medically unexplained symptoms, which means persistent health symptoms which remain unexplained after a complete medical evaluation. A syndrome is a collection of signs and symptoms known to frequently appear together but without a known cause. Being given a diagnosis of MUS can be a relief because you have a label, a diagnosis, but the key is how to manage. Types of somatoform disorders. There are many types, but I will concentrate more on medical unexplained symptoms. The prevalence of medical unexplained symptoms is 25 to 75% of patient visit to primary care physicians. The most 8 common complaints of medical unexplainable symptoms are fatigue, back pain, headache, dizziness, chest pain, dyspnea, abdominal pain, and anxiety. 10 to 20% of American medical budget is spent on somatization, and it is very huge. The causes of somatization are many, but the main are genetics, social learning, and culture. In the cultural aspect in multiple unexplained symptoms, many patients presenting to medical outpatient clinic in Pakistan complaining of unexplained symptoms. Another series of studies in China and Taiwan found that somatization was the main language of distress and was used to express psychological disorder. The traditional claim that somatization is more typical of patients from non-Western and developing countries. But the evidence shows now that the somatization is a universal phenomenon. According to this study, somatization is more in Latin American population. Why? Because of social factors such as poverty, low education level, work conditions, and presence of violence. Reports from the Arab world show a high incidence of patients complaining of depression and anxiety and a variety of somatic symptoms. A screening study in Saudi Arabia said that The prevalence rate of somatization is 19.3. On the other hand, a study showed that 48%, a huge percentage of a sample of patients are coming up for psychiatry problems. In Qatar, it showed that it is 12.4%, and it is lower than the international rate, but it's similar to UAE. Why? It is because of stressful life events and adverse childhood experience. Compared with the year before of disaster, survivor reported a higher number of multiple unexplained symptoms in the general practitioners after 2 years. A study that was done in Oman showed that somatization and psychological morbidity are common in Oman. Now, thank you for listening, and I hope you enjoyed this presentation.